Welcome back viewers. So this is the last part of the 5-part video series of the human skeletal system. In the previous part of this video series, I have shown you the bones of upper limb and lower limbs with their respective girdles. In the 4th part of the video, I have covered pelvic girdle and vertebrae. This part, being the last of the 5 part, covers the skull bones along with its sutures and foramens. The skeleton of head is called skull. It consists of several bones that are joined together to form the cranium. Skull is made up of different bones: 8 cranial bones, 14 facial bones, 6 ear bones, and 1 hyoid bone. I am continuing from the view of the cervical vertebrae, which was shown in the previous part. I am starting with the hyoid bone, which is a U-shaped bone and is divided into 3 main parts, which are visible here: the body, greater horn, and the lesser horn. Anterior surface of the body provides insertion to geniohyoid and mylohyoid muscles, and lesser cornu provides attachment to stylohyoid ligament at its tip. Speciality of hyoid bone is that this is the only bone which does not articulate with any other bone. In a suspected case of murder, fracture of hyoid bone strongly indicates throttling or strangulation. Now I will talk about the facial bones. They consist of a single mandible and vomer and pairs of maxillary, zygomatic, nasal, lacrimal, palatine, and inferior turbinate bones. The mandible is the largest bone of face. Maxilla is the second largest bone of the face. The two maxilla form whole of the upper jaw. All maxillary teeth, that is central incisor, lateral incisor, canine, first and second premolars and molars are seen here attached to maxilla. Then you can visualize pair of lacrimal bones which is present in relation to orbit, and here you can see a pair of nasal bone. The nasal bone is one of the most commonly fractured bone of face. I will talk about rest of the facial bones, that is the zygomatic, vomer and palatine bones, later in this video when they are focused. Now we will look at cranial bones, which are 8 in number. They are 1 frontal, 2 paired temporal, 2 paired parietal, 1 occipital, 1 sphenoid, and 1 ethmoidal bone. Now you see the frontal bone, which has glabella on its outer surface. You can see the right zygomatic bone, which is a facial bone. The next cranial bone is the right temporal bone, which can be found at the side and base of skull. Now we move on to the sphenoid bone, which has 2 greater wings and 2 lesser wings on each side, and it looks like a butterfly. Here you can see the parietal bone of the right side and 1 occipital bone, which is found at the back of the skull. I will talk about the ethmoidal bone later in this video when it is focused. First, have a look at mandible or the lower jaw. It is the largest and strongest bone of face. It consists of body and 2 processes. Now you see the oblique line on outer surface of mandible. It gives origin to the buccinator muscle. Here we can see 1 foramen, which is mental foramen, which gives passage to inferior alveolar nerve. Also, you can see a protuberance in the lower part of the midline, which is known as mental protuberance. Size and shape of bone making up this mental protuberance are responsible for size and shape of person's chin. Continuing with the parts of mandible, this is the angle of mandible. Fracture of angle and neck of mandible is second most common fracture of mandible. This quadrilateral area that is shown here is known as ramus of mandible, which provides attachment to muscles of mastication. Now you can see the processes of mandible. One is coronoid process, where temporalis muscle is inserted, and another is condylar process, which is the process on mandible that articulates with the disc of temporomandibular joint. Then you can see at the inner surface of mandible there is some mandibular fossa, mylohyoid line, which gives origin to mylohyoid muscle. At medial surface of ramus, you can appreciate mandibular foramen, which transmits inferior alveolar nerve and vessels. This foramen is marked by a sharp tongue-shaped projection called lingula. Now we will discuss about maxilla. There are four processes of maxilla: the palatine, the alveolar, the zygomatic, and lastly the frontal process. The frontal process has been shown earlier, and later on we will see zygomatic process. Now you are able to see the palatine process and the alveolar process. This is the incisive foramen, which is just above the incisor teeth. It gives passage to greater palatine vessels and terminal part of nasopalatine nerve. At posterior end of palatine bone there is posterior nasal spine, which is a part of horizontal plate of palatine bone. It gives attachment to the uvula muscle, and this is pyramidal process of palatine bone, which projects downward from the junction of two plates of palatine bone. Its superior surface has greater palatine foramen. The contents of greater palatine foramen are greater palatine vessels and anterior palatine nerve. Next, you can see a thin flat bone known as vomer. It forms posterior inferior part of nasal septum. On focusing onto the posterior view of sphenoid bone, there is a lateral pterygoid plate and a medial pterygoid plate on each side of the body of the sphenoid, which gives origin to pterygoid muscles. Now we will look at foramens of skull as visible intracranially. The structure you now see is jugular foramen, which gives passage to inferior petrosal sinus, sigmoid sinus, the cranial nerves 9, 10 and 11 called the glossopharyngeal, vagus and accessory nerves respectively, sigmoid sinus and inferior petrosal sinus, which are formative tributary of internal jugular vein. Foramen spinosum, ovale, lacerum, pharyngeal tubercle have been shown above jugular foramen, which we will discuss later on. Near jugular foramen, you can visualize hypoglossal canal and carotid canal. Hypoglossal canal gives passage to hypoglossal nerve, that is the 12th cranial nerve, and carotid canal gives passage to internal carotid artery and sympathetic nerve plexus. This is the infraorbital foramen, which transmits infraorbital vessels and nerve. Next, in view of zygomatic bone, you can see a small foramen in mid-lateral surface of zygomatic bone, that is zygomatico-facial foramen, which transmits zygomato-facial nerve and vessels. Now have a look at the orbit. Its lateral wall is the thickest part and it is formed by greater wing of sphenoid bone and orbital surface of zygomatic bone. Floor of orbit is formed mainly by orbital surface of maxilla. Its medial wall is mainly formed by lacrimal bone, orbital plate of ethmoid, as you can see here. At the junction of roof and lateral wall, there is inferior and superior orbital fissure, which is present between lesser wing and greater wing of sphenoid bone. Here you can also appreciate optic canal, which gives passage to optic nerve and ophthalmic artery. Now focusing near greater wing of sphenoid, there is H-shaped suture, which you can see here is known as pterion. The pterion is known as the weakest part of the skull. Pterion is formed by parietal, frontal, temporal and sphenoid bone. In the temporal bone, you can see mastoid process. The mastoid process is a bony lump you can feel behind the lower ear. Its lateral border forms margin of external acoustic meatus, which is responsible for collecting sound waves and conveying them to the eardrum. Above the external acoustic meatus, there is supramastoid crest, temporal fossa, and superior temporal line. The supramastoid crest is a strongly marked prolongation of the upper border or the posterior root of the zygomatic process. The temporal fossa is the area on the side of the cranium from which temporal muscle arises. The superior temporal line gives attachment to temporal fossa. So we have seen all the bones of the skull and now we will proceed to sutures of skull. Skull bones are united mainly by sutures. Have a look at the coronal suture, which lies in the coronal plane. It is present between frontal and two parietal bones. This is the anterior fontanelle, which is also known as bregma. Bregma persists until approximately 18 to 24 months after birth and is meeting point of coronal and sagittal suture. Between two parietal bones, you can appreciate sagittal suture. Behind it, you can see posterior fontanelle called the lambda, which is present between sagittal and lambdoid sutures. The posterior fontanelle usually closes by age of 1 to 2 months. If it stays big or doesn't close after about a year, it is sometimes a sign of genetic condition such as congenital hypothyroidism. Fontanelles are sites of growth of skull. If fontanelles fuse early, then brain growth is stunted and such children are less intelligent. Now, if we focus behind the occipital bone, there are two bony ridges known as superior knuckle line. To the superior knuckle line, the splenius capitis muscle, the trapezius muscle, and the occipitalis muscle is attached. You can also see a medial prominence here known as the external occipital protuberance. It is a raised area on the midline of the occipital bone where posterior wall meets the base of the skull. It is a junction of head and neck and it is easily felt in the living. Inferior knuckle line. To the inferior knuckle line, the obliquus capitis superior muscle, rectus capitis posterior minor muscles are attached. In the posterior cranial fossa, you can see the foramen magnum. The foramen magnum is the largest foramen of the skull. It is located in the most inferior portion of the cranial fossa as a part of the occipital bone. Its anterior compartment contains ligament and posterior compartment contains neurovascular structures. Behind either condyles of occipital bone, you can appreciate condylar fossa, which receives the posterior margin of superior facet of the atlas when the head is bent backward. Now let's discuss something about mastoid notch, styloid process, mandibular fossa and articular tubercle. The mastoid notch gives attachment to digastric muscle. The styloid process projects from the inferior part of the petrous part of the temporal bone and gives attachment to stylohyoid ligament and the stylohyoid, stylopharyngeus and styloglossus muscles. The articular tubercle is a bony eminence on the temporal bone in the skull. Now we will have a look at base of skull. Now let's focus on the posterior cranial fossa where you can see internal occipital protuberance which gives attachment for tentorium cerebelli and is grooved on each side by transverse sinuses and superior sagittal sinuses. Near it we have internal occipital crest which gives attachment to falx cerebelli. Here in this view, you can see the wings of sphenoid, petrous part of temporal bone and basilar part of occipital bone. You can see a saddle-shaped depression in the body of sphenoid bone known as sella turcica. The sella turcica has hypophyseal fossa which holds the pituitary gland. You can also appreciate three foramens in the skull base: foramen ovale, foramen spinosum and foramen lacerum. Foramen ovale gives passage to mandibular nerve, accessory middle meningeal artery, lesser petrosal nerve and emissary vein. Foramen spinosum gives passage to middle meningeal artery, middle meningeal vein and meningeal branch of mandibular nerve. Foramen lacerum gives passage to meningeal branch of ascending pharyngeal artery and emissary veins. Also visible here is the internal auditory meatus which gives way to the vestibulocochlear nerve, that is cranial nerve 8, facial nerve, that is cranial nerve 7 and labyrinthine vessels. This is sagittal sinus groove for the sagittal sinus. The purpose of the sagittal sinus is to carry waste and fluids away from the brain as veins do throughout the rest of the body. So this was all about human skull. I hope you found this video helpful. This was the last part of the human skeletal system. With this, I have completed the bones of the whole human skeletal system. Hope you would have followed the previous parts also to get a better understanding of the whole human skeletal system. To get updates on my upcoming videos, please refer to my channel playlist. Don't forget to subscribe my channel. Thank you for watching.